So hi everyone, I'm Yash, and in this video we are going to discuss about MRI, that is magnetic resonance imaging. So these are the topics which we are going to cover in this presentation, starting with the introduction, the historical development, key components, working principle, how the body reacts with MRI, the clinical applications, and its advantages and limitations. So let us start with a basic introduction to MRI. So MRI is a powerful diagnostic tool that utilizes strong magnetic field and radio waves to create detailed images of the internal structure of the body. It is a non-invasive imaging technique, and it is widely used in the medicine industry for diagnosing a wide range of conditions from neurological disorder to musculoskeletal injuries. MRI has revolutionized the medical diagnostic, offering a safe and more accurate alternative for visualizing the internal structure and anatomy of the body. So now let us see the historical development of MRI. In the year 1946, two physicists named Felix Bloch and Edward Purcell, they discovered the phenomena of nuclear magnetic resonance. Both of them were awarded Nobel Prize in Physics in the year 1952. In the year 1971, Raymond Damadian, he demonstrated that NMR signals could differentiate between healthy and cancerous tissues, and he proposed using the NMR technique for medical imaging. Further, in 1975, Peter Mansfield, he refined the use of gradients, enabling fast and precise image reconstruction. In the year 2003, Paul Lauterbur and Peter Mansfield, both of them received Nobel Prize in Medicine for their pioneering work in the MRI technology. So now let us see the key components of MRI. So basically there are four main components of MRI. It is main magnet, gradient coil, radio frequency coil, and a computer system or a scanner. So this is a schematic representation of an MRI machine. We can see there is a patient lying on the patient table and he is covered with magnets and radio frequency coil. Now let us see each of this component in detail. So the main magnet, it is typically a superconducting magnet cooled to near absolute zero using liquid helium. The field strength is measured in the unit Tesla. Most clinical MRI machines range from 1.5 Tesla to 3 Tesla, while the research system goes up to 7 Tesla. The gradient coil, it creates a variable magnetic field along the X, Y, and Z axis. It is essential for spatial encoding, allowing for imaging of specific sections of the body. Radio frequency coil. It serves as a transmitter and receiver of radio frequency signal. Different types of coil like head coil or body coil optimize imaging for specific body parts. Computer system. It controls the MRI machine. It processes the signals and reconstructs the image. It uses advanced algorithm to convert raw data into high resolution images. Now let us see the working principle behind MRI. So MRI relies on the interaction of magnetic field and radio waves with hydrogen atom, the third most abundant element in the human body after carbon and oxygen. The magnetic field aligns the hydrogen nuclei, and radio waves cause these nuclei to briefly change their alignment. As they return to their original state, they emit signals that are detected and processed by the MRI machine, creating a detailed image of the body's tissue. The strong magnetic field generated by MRI machine aligns the hydrogen nuclei in the body, creating a uniform magnetic field. Radio waves are transmitted into the body, causing the aligned hydrogen nuclei to absorb energy and momentarily change their orientation. As the hydrogen nuclei return to their original state, they release the energy in the form of radio waves which are detected by the MRI machine to create an image. Now, let us see how the human body interacts with MRI. So, different tissues in the body have varying density of hydrogen atom, which affects how they interact with the magnetic field and the radio waves used in MRI. For example, Water-rich tissues like muscle and organ produce a strong signal, whereas the fat and bone produce weaker signal. This difference in signal intensity allows MRI to distinguish between different types of tissues and identify the abnormalities within them. Like the water-rich tissues, muscle organs and other tissues with high water content produce strong signal in MRI and it appears brighter in image, whereas fat have a lower water content producing weaker signals in MRI and it appears darker in image, whereas the bone almost contains negligible amount of water resulting in very weak signals in MRI and it also appears dark in image. Now let us see some clinical applications of MRI. It can be used in neurology for detection of brain tumors and damage. Functional MRI can be used for assessing brain function. Mapping activities can be used in orthopedics for evaluation of ligament tears, cartilage damage, and bone infection. It is also essential for diagnosing soft tissue injuries. It can be used in cardiology for assessment of heart structure and blood vessel condition. MRI angiography provides detailed image of the blood vessels without using any contrast agent. It can also be used in oncology for cancer detection, staging, and monitoring treatment response. It is especially effective for imaging soft tissue tumors. Now let us see some advantages of MRI. Number one, it is non-invasive. MRI does not require any surgical procedure or incision, making it a comfortable and safe experience for patient. Number two, it is radiation free. MRI utilizes strong magnetic field and radio waves which are non-ionizing and do not pose any radiation risk to the patient. Number three, detailed imaging. MRI provides high resolution image with excellent contrast between tissues, allowing for precise diagnosis and monitoring of various conditions. Now, here are some of the limitations. First is high cost. It is expensive to purchase, maintain, and operate. It has lengthy scanning time, scan time may range from 30 to 60 minutes and requires the stillness of the patient. Number three, people who suffer from claustrophobia may have anxiety. Number four, patient with metallic implants. It is contradicted for patient with implants such as pacemakers. So this brings us to the end of our presentation. Thank you, everyone.